welcome back. Nice to see you again. I hope your lower extremity stretching went really well. Today we're going to do lower extremity strengthening, level 1. This is basic strengthening exercises that are non-weight bearing. These are great exercises for patients who have some joint issues, whether it be just some inflammation, arthritis, degenerative changes. These are really good exercises to start with. Once you feel like you're getting stronger, pain is maybe reducing, then you can progress yourself to the level 2 exercises, which are going to be more weight bearing. Okay, so we're going to start off today with some bridges. These are really good for your low back and hips. Again, just like with the stretching, if you don't have a table like this, you can do these on the floor or on your bed. So you're going to lie with your knees bent, feet flat. Your knees are going to be about hip width apart, so they're not touching each other. They're going to be apart a little bit. Hands are down on the table. You're going to tighten your stomach muscles. Imagine you're pulling your belly button toward your spine, and you're just going to lift up. You're going to hold this for 5 seconds, and then slowly lower down. Only lift as high as is comfortable. It shouldn't cause any pain in your low back or your hips. If it does, don't lift as high. Okay? You're going to do 10 of those with the 5-second hold. Next exercise is a clamshell. You're going to roll to your side. You're going to lay with your knees bent, feet together. You're going to lift your knee up like you're opening and down, closing. The most important thing with this exercise is that you don't lift so high that you start to roll back, okay? Your hips should be staying stacked up on top of each other as you lift. Sometimes if patients are having a really hard time with this, I'll tell them to do it with a wall to their back. You can do it against your headboard. You can do it on the floor against a wall. But the wall will force you to stay in this position and not roll back. You're going to do 2 sets of 10 of these clamshells. Now if you do 10 and you're tired, then just do 10. Okay, you're going to do it on both sides. Staying on this side, the next one is a hip abduction. So you're going to keep the bottom knee bent and you're going to straighten your top leg. Make sure when you look down that your leg is in line with your shoulder. Your hip, knee, and ankle should be in line with your shoulder. It shouldn't be way out here in front of you. Okay? It's going to feel like it's almost behind you. And then you're just going to lift up and down, like so. Only lift as high as is comfortable. If you feel like you're lifting and you're coming forward, don't lift so high. You're trying too hard. It's more important that you have good form and technique than you're lifting as high as possible. Again, 2 sets of 10 if you're able. Next, I'm going to lie back on my back. I'm going to straighten out my leg. I'm going to tighten my stomach muscles just like I did with the bridges. And I'm going to lift my leg up to the level of the other knee and back down slowly. Maintain that tightness in your stomach muscles to make sure that you're using your core and supporting your lumbar spine while you do these leg lifts. Again, 2 sets of 10 on each side. Next, you're going to sit up. You can do this seated in a chair. If you have a tall chair like a bar stool, that's great because then your feet are dangling and not sitting on the floor. But if you don't, it's okay. You're going to gently, slowly kick your leg out in front of you and slowly lower it down. Kick out in front of you and slowly lower it down. Again, 2 sets of 10 on each side. For the last 2, you're going to stand up. So here I am standing. You can hold on to table, countertop, back of a chair for balance. You're going to do a standing hamstring curl. So just lifting that leg, bending at the knee, pulling your heel toward your bottom, and switch. Make sure that you're standing up tall, looking straight ahead, not looking at the floor, not bending over. Good tall posture. Last one is a heel raise. Again, standing and holding on to your table, back of the chair, countertop. You're going to go up on your toes and back down. Up and back down. You're going to do 2 sets of 10 of these. Make sure when you do these, your ankles don't roll out. You should not be rolling out as you go up. You should be straight in line with your second toe. Thank you so much for joining me today for the lower extremity strengthening. That was a really great workout. Not too bad, doesn't take too long to do, very manageable. Now, if you find that these are pretty easy for you, you want to make them a little harder, the bridges and the clamshells, you can wrap a TheraBand around just above your knees to create some resistance. For the straight leg raises on your side, for the straight leg raises on your back, for the standing hamstring curl, and the seated leg kick out, you can add an ankle weight if you have one. If you don't worry about it. You can try putting on a heavier shoe, but it's not necessary. Doing the exercise is better than not doing the exercise, okay? Thanks a lot for joining me. I will see you next time for lower extremity strengthening level 2. Bye-bye.